Some kids have problems learning, they have trouble reading, and sometimes they're diagnosed with a condition called dyslexia. Sometimes they have visual problems, or sometimes people feel there are some ways you could help them with some visual training. Is there any merit to that?
Well, the first thing that we have to do, there's certainly a lot of patients being diagnosed today with dyslexia. And the first thing that we have to basically make sure of is that the child doesn't have a visual issue. So we certainly want to check them for farsightedness. They can have a latent amount of farsightedness, which is not picked up on a normal examination. They could be nearsighted. They can have an astigmatism. They could even have a convergence insufficiency, which means that their eyes do not stay together when they read and they lose attention. They can even have an actual auditory problem where they don't hear properly. So we want to basically rule out those problems first. In terms of vision training, it's a very controversial issue. A lot of times parents will do anything to help their children with dyslexia, and they'll bring them sometimes to practitioners who will oftentimes immediately say that the child needs vision training. A lot of times the actual results that are obtained in these methods might be incidental, or it might be that, gee, you know, my child did better after a year of vision training, and it's because of the vision training that he did better. Sometimes, though, if you did nothing for the child, just simple maturity and time would have made a lot of the problems resolved. So I don't want to completely tell parents that it's not a good thing to do visual training, but I just want to make sure they understand that very often it might not be necessary. And a lot of the information that you get from patients who have had success with visual training might be simply incidental. So I don't normally refer my patients for vision training.
Can any harm come from visual training?
Well, the only harm that can come might be to your wallet. And the other harm that might come from it is it might delay the proper remedial educational help that the child deserves and should have properly obtained earlier. We don't want to delay their educational help from the appropriate educators to basically deal with their particular specific learning disorder.
A dyslexic child to learn has to be put in a certain type of classroom setting that's a major problem.
Yeah, they sometimes might need a para. They might even need some tutors. But they need somebody skilled to know what the actual area of their deficit is. Is it reading? Is it mathematics? And usually a skilled person who deals with dyslexic children or children with specific learning disorders can locate the problem that the child has and teach the child how to deal with it properly so that he could go on. These children normally have a completely normal mentation and an IQ, and they do very well with the proper educational help.
There are very famous, successful people that had dyslexia.
Absolutely. Lawyers, doctors, scientists. It's a problem that once you learn how to deal with, you can get through life very, very easily.